Good morning. Thank you for joining us, Sue Nelson,
Hey,
American
Sue.
Heart Association.
Good to see you.
I'll
Thanks
make
for
a
being
few
here.
remarks and introduce you.
Thank you.
So good morning, everyone, and welcome to our Protect Patients Now event. I'm Sue Nelson, the Vice President of Federal Advocacy for the American Heart Association, hence the red dress. Although my work focuses on individuals with cardiovascular disease and stroke, I'm here as a representative of all the associations gathered in this room, and I see many of my colleagues here today who are the voice of patients and consumers regardless of their age, race, sex, or political affiliation. And our groups do represent all Americans. Admittedly, I'm a bit of a numbers geek, having spent many years on the Budget Committee, but this factoid astounded me. 75% of Americans aged 45 to 54 and 84% aged 55 to 64 have at least one pre-existing condition. So if you don't have one today, eventually you will. We have some t-shirts here in case you want to get your t-shirt ahead of time. Our groups came together in January over a plate of breakfast burritos and agreed to work together to represent the interest of patients and consumers in any legislative negotiation over health care. We united as the informally named Burrito Coalition. All the other names were taken, so we stuck with that one, behind a set of principles fundamental to ensuring that Americans continue to have access to affordable and adequate care. We're now 22 groups strong, and we've also worked collaboratively with many other organizations, and including Consumers Union, which has joined us here today. Unfortunately, we've been largely ignored in this process, but frankly, we're in good company. The views of doctors, hospitals, insurance companies, many governors, and most recently, all of the Medicaid directors have also been disregarded. If those who work in every aspect of our healthcare system are being discounted, along with patients and consumers, one wonders, who do these lawmakers feel accountable to? The Graham-Cassidy legislation, which will be the subject of today's Finance Committee hearing, falls far short of the standards we set based on the most objective analysis we've been able to get to date. Many of our groups submitted statements that outline the aspects of this bill that concern us and that hurt our constituencies, but one fact stands out. Based on a recent analysis by Brookings, this legislation would reduce the number of people with insurance company by around 21 million between 2020 and 26, and 32 million after 2026. The bill also offers no guarantee of adequate and affordable coverage for individuals with pre-existing health conditions, and we just learned this morning that changes made in the bill over the weekend further erode protections that now exist under current law. For example, we understand there's no longer any requirement that states have to cover preventative health benefits, which for many of our diseases is clearly a non-starter. So the bill is a non-starter for us, and make no mistake, American lives will be lost if this bill is enacted into law. The American Cancer Society Cancer Action Network will represent the patient voice at today's hearing, and I'm sure they'll do an outstanding job of articulating the many policies that we all believe are detrimental to patients and consumers. But today, patient voices fill this room, and their stories fill our hearts. They each have their own unique situations, but their hardship, worries, and heartbreak are shared by many. We have, for example, Ashe Nemirovsky, a lung cancer patient from Pennsylvania. We have Jody Lee Max and her son Joshua, who was born with a very serious heart defect. And finally, three-time cancer survivor Steve Taylor, who came all the way from Alaska for today's press conference and hearing. But before we hear their stories, it's my pleasure to introduce Senator Bob Casey of Pennsylvania, who can provide his perspective on this legislation. Throughout the past year, all of our groups have worked closely with Senator Casey and his staff to try to understand how we constructively engage in this incomprehensible process. Senator Casey has worked tirelessly to ensure that patients like ours have access to quality, affordable health care. He's been a huge champion for the disability community and worked hard to keep the Medicaid program a right for everyone who is eligible. Senator Casey?
Thanks so much. Thanks for your work. Sue, thank you very much. Thanks for getting us started, and I know we want to get to the folks who will come to this podium, but I do want to express gratitude for everyone taking the time to be here. on this day. So I'm happy to see everyone, but wish we were here gathered to talk about how we move forward in a positive direction on health care instead of debating and having a hearing today about a bill that will turn us in the wrong direction, really take us backward. But that's what we have in front of us, and that's the task ahead. It's our responsibility to keep working, stay together, and to advocate against this bill, because this is a bad bill for so many reasons. Many of them you've heard. I'll just outline 2 or 3, but I think you've already heard plenty to raise concerns. I'm especially grateful that Ashley and Jody and Steve are here, and so many people representing them and helping them. I want to thank all those who have either a red T-shirt or an orange T-shirt. I wore a blue tie. I didn't get the right memo, I guess, but no. But we're grateful for that, and grateful you're willing to take the time to be with us. Just a couple of comments. First of all, I've described this bill in very blunt terms. The bill, the legislation, which has been developed in the Republican caucus in the U.S. Senate, is, in my judgment, a snake in the grass. I wish it were only a snake that could bite you but not cause harm, but I think it's a venomous snake that will cause great harm to people. At least will cause them great harm because they will lose their health coverage. But of course, you can imagine what happens after that for a lot of people. I'll leave that to others to analyze and speculate what happens after you lose your coverage. But I think a lot of people in this room understand what happens. So the unfortunate thing is that it is a snake in the grass because it will bite people who will be unsuspecting, won't even know that that threat is closing in on them before they actually get bitten. So for a lot of reasons, we've got to stop this bill. When I look at it from the perspective just of Pennsylvania, that's reason alone for me to be unalterably, totally opposed and to be resolute to stop it. Here's among many, many numbers, and we can get lost in the numbers, but these are compelling, at least for Pennsylvania, in terms of dollar amounts. The coverage impact, the adverse impact on coverage, we have a sense of, but we might learn, I hope we'll learn more from a preliminary review or preliminary report by CBO. But here's what Avalier says. Pennsylvania would see a $6 billion reduction from the year 2020 to the year 2026, another $15 billion reduction in 1 year, 2027. So I'll limit it to that. Basically, a decade, Pennsylvania loses 6 plus 15, $21 billion. That's hard to comprehend in any state, even a big state like Pennsylvania. And you know, we benefited tremendously when the state made a decision led by Governor Wolf to make sure that Pennsylvania took advantage of Medicaid expansion. More than 733,000 Pennsylvanians enrolled through Medicaid expansion. They are all at risk, or at least could be at risk. I will assert they are at risk because of the way that this bill completely winds down and eliminates Medicaid expansion. That's a really bad idea. I have to ask my Republican friends, is there something wrong with 11 million Americans getting health care coverage through Medicaid expansion? Is that a bad thing or a good thing? I think it's a good thing. Thank goodness they have that coverage. If anything, I hope we could expand Medicaid even further. That would be a good idea. It's a proven program. It's a good program. 70 million Americans get their health care through, 70 million plus, through Medicaid. 45% of all the births in the United States of America are paid for by Medicaid. And that's the program they want to decimate and wind down parts of and undermine and gut. Pick your adjective. Pick your action verb. It's there, what they're trying to do to Medicaid. 60% of children with disabilities get their health care through Medicaid. And they want to decimate Medicaid? 40% of children overall. Millions of adults with disabilities and children with disabilities. I don't understand this. I really don't understand why they want to do this to Medicaid. And I thought we had a national consensus, finally, after decades, that finally we said as a nation, we will never allow a pre-existing condition to be a barrier from someone getting coverage or treatment. I thought that was over. I thought we made that practice, that pernicious practice, illegal. And I know the other side is saying, oh, we have language in there. We don't need anything new on this. We want the law on pre-existing conditions the way it is today, not the way they have it in this bill. So I want to wrap up because you got to hear from people that have important testimony to give. I guess the last question I have to ask is, when you look at the group, Sue represents here on behalf of the American Heart Association, but I have a short list in small print of all the groups who are against this bill and have been against all these bills. I'll just mention a few. The American Medical Association, American Academy of Family Physicians, American Academy of Pediatrics, on and on in terms of medical groups. AARP is against it and has been against other bills. Patient groups, ALS Association, American Cancer Society, Heart Association. Those 10 governors from both parties against it, and putting on paper very clearly why they're against it and what we should be doing to lower costs and to work on problems in our healthcare system in a bipartisan way, which we were for 2 weeks until they pulled the rug out from under their own party and Democrats working together. A total repudiation of a good, constructive, bipartisan, limited, but a good, constructive, bipartisan process. So the last question I have is, when you consider all those groups that are against this bill and have been against virtually every bill the Republicans have proposed this year, are the American people supposed to believe that all those groups, with probably hundreds of years cumulatively of expertise, but at least decades of experience, right? People who spend their lives studying healthcare, people who spend their lives bringing healing and hope to people, that are a part of the process of curing people. All of those groups we're supposed to believe are all wrong. All those groups are 100% wrong, and a small number, and I say this respectfully, a small number of Republican United States senators are right. I mean, that's what they want to have us believe. Does that make any sense at all? That all these groups are wrong, and this small group of Republican senators are 100% right. That this bill they have will be much better for everyone. We're supposed to just believe it. And thank God we have one hearing. Isn't that great? We're going to have a hearing this week. We had 2 weeks of hearings on much more narrow issues. But we're going to have one hearing, and we're going to rush a vote, maybe by Wednesday, on maybe the most significant impact on our healthcare system in a long, long time. That doesn't make any sense. I think the American people understand this. But in case we haven't persuaded a few folks out there, we want to keep going, keep advocating, and I'm grateful that people are willing to do that. So let's get to our witnesses. Sue, I know you'll introduce each of them by name and give some background, but we're eternally grateful that they're here today to tell their stories. Thank you very much.
So we all thought this issue was resolved too, right? It's like it came back out of nowhere, which is why the Burrito Coalition may be renamed the Margarita Coalition later this week, if we survive the week. All right, so what I'd like to do is ask our speakers to come up now. We have Ashe Nemirovsky, who is planning to go first. Great. Followed by Jody Lee Max and Steve Taylor. And I'll let them give some background on themselves.
Hi, good morning. My name is Ashe Nemirovsky, and I live in Wayne, Pennsylvania, along with my husband, Jared. I'm a 24-year-old woman with a pre-existing condition. I currently have stage 4 non-small cell lung cancer. For the last 5 years, fighting lung cancer has become the norm for us. I'm honored to be here today as an American Lung Association volunteer to share my story to kind of put a face to why healthcare coverage is so vital, to why the Senate needs to stop the Graham-Cassidy healthcare bill. So I want to thank Senator Casey for his continued support and commitment to ensuring that I and everyone else have quality and affordable healthcare. So thank you so much, Senator Casey. I learned firsthand the importance of healthcare when I was first diagnosed with lung cancer at the age of 19 as a sophomore at Penn State University. My diagnosis was shocking and it occurred by chance after a campus doctor was proactive and decided to take an x-ray of my lungs, which led to my diagnosis of stage 2 non-small cell lung cancer. I quickly underwent surgery. My doctors removed a golf ball-sized tumor and 20% of my right lung, followed by 4 months of chemotherapy and 9 weeks of radiation therapy for 5 days per week. By June of later that year, I was diagnosed with no evidence of disease. I thought I was in the clear and had beaten the disease for good. I was in remission for 3 years until June 2016, when I relapsed and the cancer was found again in my lungs, my T11 vertebrae, my lymph nodes, and the left frontal lobe of my brain. I've undergone since then gamma knife radiation therapy to my brain, followed by brain surgery, 3 rounds of high-powered radiation to my spine, and I'm currently on an oral chemotherapy specially targeted for the ALK mutation that I have that I will be on for the rest of my life. Since the first day my battle began, I've undergone countless procedures, MRIs, CT scans, PET scans, appointments, and blood draws. I've had multiple surgeries, emergency hospital visits, and ambulance rides. If that wasn't enough to manage, I'm now forced to be consumed with the fear of what could happen to me if something like the Graham-Cassidy bill becomes a law. When I was first diagnosed, my health care was provided through Pennsylvania's Medicaid program, known as medical assistance. Once my husband and I got married, I was no longer eligible for Medicaid, and I was allowed to purchase my health care through the Pennsylvania Marketplace, which was created by the Affordable Care Act. In 2015, when I purchased my own health insurance, I was not penalized or charged more because of my pre-existing condition. With this Graham-Cassidy bill, I could be charged more because of my pre-existing condition, and quite frankly, I do not have more to spend. The medication that I rely on to keep my lung cancer at bay is cutting-edge treatment. It is kind of immunotherapy that was only made possible because of the billions of dollars that are committed to cancer research at the National Institutes of Health, which I'm proud to say are virtually everyone in Congress supports. I'm asking in the spirit of bipartisan commitment to cancer research, let's take that same bipartisan commitment to creating health care for the millions of Americans who need affordable and quality health care to help fight cancer. Just one of my treatments costs $15,600 a month. In the 13 months I have needed that treatment, that would have totaled $202,000 in out-of-pocket costs. I'm worried that if the Graham-Cassidy bill were to become law, the cost for premiums on the Pennsylvania exchange would skyrocket, and my husband and I would not be able to afford them, making my medicine unaffordable to us. I'm also worried that some of the key patient protections that don't allow insurance companies from limiting how much they pay for my care each year and over my lifetime could be taken away. I know firsthand that our healthcare system is not perfect, but just taking it all away from people like me who need it would be devastating, and quite frankly, it's just not fair. The 32 million Americans who could lose healthcare, who are real people, who are not just a number, we have names and we have faces, and I'm here to say and prove that I'm one of those faces. So I ask all the senators, and I hope and pray that all senators will oppose the Graham-Cassidy bill. So thank you all for listening.
Good morning. I'm Jody Lee Max, and this is my son Joshua. I've been volunteering with the American Heart Association for 12 years now, and I'm also the National Program Director of Mended Little Hearts, a national nonprofit that supports families with children with congenital heart disease all across the nation. Thank you for letting us be here today and stand in opposition with you in opposition to the Graham-Cassidy bill. Back in May, when I heard Jimmy Kimmel's tearful account of his baby's heart condition, it brought back memories of my own experience 14 years ago when Joshua was born with a complex heart condition. My joy about having my third child turned into fear and sadness. A routine ultrasound at 5 months uncovered that one of my baby's heart chambers was too small to ever function. He would be born with a congenital heart defect, the most common birth defect in the United States. They also told us that if we didn't work fast to obtain treatment for my child, his heart would stop beating forever. That treatment consisted of 3 or more open heart surgeries in his first 3 years of life. One was on the day he was born. Without them, he would not live. Even with them, his chance of survival at that time was only 5%. But we thought we had good health insurance and that most of the cost of the surgeries would be covered. Boy, were we wrong. The doctors that performed Joshua's first surgery weren't obligated to accept our insurer's coverage as payment in full. This meant that we had to pick up the difference between the doctor's bill and the insurance payments, which was almost $100,000 just after the first 2 surgeries. But the bills weren't the only problem. Because of Joshua's condition, we were at high risk of losing insurance completely. Since Joshua's father was self-employed, we weren't on an employer-based plan, so we were on our own to cover all of the costs of our insurance and premiums. When the Affordable Care Act passed in 2010, we were so relieved. No longer would my son be excluded for his pre-existing condition, nor would we have to worry about lifetime caps because Joshua's heart may never be fixed. I want our lawmakers to know that if Graham-Cassidy passes and these safeguards disappear, they will be putting my son's life and the sons of so many other children, 40,000 babies a year born with this heart disease, they will be putting their lives in jeopardy. As Jimmy Kimmel pointed out, most Americans aren't as lucky as he is when it comes to being able to afford the best medical care. This is especially true when it comes to Americans with congenital heart disease. 50% of them rely on Medicaid for their health coverage. No family should ever have to go through what we went through. To watch your baby have open heart surgery is devastating. It can almost shatter you. But it would be even more unbearable if you couldn't afford to give your child the treatment and the care that he or she needs to live. We desperately need the protections in the Affordable Care Act. Please don't take them away. Vote no on the Graham-Cassidy bill. Thank you.
Hi, my name is Steve Taylor. I'm from Anchorage, Alaska. This is the 3rd time I've come to Washington in the last few months as a volunteer with the American Cancer Society Cancer Action Network. Each time I've come to plead with my senators to reject a damaging health care bill that would possibly or could make it impossible for me and many of you here in the room to be able to get the care that we need. I was 29 the first time I was diagnosed with cancer. It was 2004, and I was diagnosed with Hodgkin's lymphoma stage 2. Eventually, I went through 6 months worth of chemotherapy and got a clean bill of health. It was devastating. No one expects a cancer diagnosis. And in 2007, I was, after a routine follow-up, I was diagnosed with a second cancer, neuroendocrine pancreatic cancer. At the time, we didn't realize I had a gene disorder that causes that type of cancer. I ended up going through a major surgery in 2007 where they took out the head of my pancreas, the first part of my small intestine, my gallbladder, and half of my stomach. I'm currently on injections to keep the remaining tumors at bay that cost anywhere from $10,000 a month and up. I take that every 3 weeks, and I'll have to take that for the rest of my life. Thankfully, I've had health insurance through my employer. And also, thankfully, due to the ACA protections, those lifetime caps have gone away, and I still have care because of it. I would have blown by those caps, and if those caps are put into place, then my care will be at risk, just like many people here in this room. We have to make sure that we keep these protections in place. I want to emphasize the point because before the current law, again, those caps were common and often left cancer patients and others with serious illnesses having to spend their life savings to save their lives. And we shouldn't have to worry about whether or not we can afford our medication or whether or not we can afford our next shot to keep us alive. The current law, again, like others have said, is not perfect, but it provides much needed patient protections for cancer patients like me and for all Americans. We need practical bipartisan efforts to fix what's wrong. We need people like you, patient groups, doctors, to all sit down at the table and to work on a bill that adds to protections and adds more people to coverage and not take away coverage from people. Once again, I urge Senator Murkowski and Senator Sullivan, my senators, and all the senators to vote no on this bill and to please come together as a country and not make this into a political game with our health care, because it is our lives. It's not politics. Thank you.
Wow. So again, many thanks to the patients who shared their story today and to the many other patient advocates who took their time out of their busy lives to be with us today, many of whom you can see in the room with their red t-shirts or their orange t-shirts. Sadly, those who need to hear the stories the most are not in this room, but we plan to take these advocates and many others into the hearing that follows at 2 p.m. in Dirksen 215 and into Senate offices after the hearing. And we will continue to amplify our message through voices in the community, our champions, and the press, as long as we have to and as many times as we have to. We're happy to take questions now, and the press should also feel free to talk to anyone, any of the patients here, again, identified by their T-shirts. Thank you very much for coming today, and thanks again, another round of applause for our patient advocates. Any questions from anyone? No? Oh, no. All right, great. Well, our folks will be in the room for a while, so if you want to talk to any of them individually, please do so. Thank you.
Great job.